Hi, my name is Terry Calandra from Calandra Center for Health and Wellness. We're located in Chicago and Schaumburg. And today we're going to be talking about what is traditional Chinese medicine. So traditional Chinese medicine is more than 3,000 years old, and it's still one of the primary medicines of China. You can think of traditional Chinese medicine as being the umbrella that includes acupuncture, herbal medicine, cupping, gua sha, moxibustion, and tui na. For cupping, you may have seen athletes with little suction cup marks on their back or other aspects of their body. Essentially, it is a fascial release, which helps to release muscle adhesions and helps with pain. Gua sha is very much the same. It's very similar. It's referred to as a fascial release, and it helps to release that muscle tension more on a superficial level of that muscle. Moxibustion is a heat therapy, which helps to bring heat into a specific area. Think of it this way. When you stick water in the freezer, it freezes, it congeals. When you put that water on the stove, it starts to bubble and move. So by introducing heat into the system, it helps to increase the blood flow and decrease pain. And tui na is a traditional type of medical massage that is really based off of acupressure and other traditional Chinese medicine theories. One of the biggest things people ask is, does acupuncture hurt? The answer is no. However, you do have sensations. So we use single-use filiform needles. These are solid. They are not hollow like a hypodermic needle. And you can see the comparison on the screen of what an acupuncture needle looks like. It's the very bottom needle compared to a matchstick and a hypodermic needle. Acupuncture is beneficial for allergies, asthma, digestive disorders, infertility, menstrual disorders, menopause, any type of pain, neurological disorders like Bell's palsy, post-stroke, neuropathy, headache, stress, anxiety, depression. The list actually goes on and on. These are just a couple. So how does acupuncture work? Acupuncture utilizes the idea of channels and meridians. As you can see in the picture over here, these lines are actually meridians that are on both sides of the body. And this actually represents the bladder meridian, which is one of the longest meridians in the body, and the dew, which is right down the spine, small intestines, meridian as well. So each meridian is associated with an organ system. When we refer to an organ system, we do not mean the physiological organ system that you can see, touch, and feel, but is associated with an organ system. When we refer to an organ system, we do not mean the physiological organ system that you can see, touch, and feel, but how it pertains to traditional Chinese medicine and everything that's incorporated with that. The acupuncture points lay on those meridians. Think of it as this. If a meridian is a highway system, those highway systems run along different nerve endings of the body. The acupuncture points, consider those to be rest stops. So each acupuncture point has a specific indication that is based on what that meridian does, as well as the location and many other things. Within the traditional Chinese medicine, we treat based off of traditional Chinese medicine patterns. We don't treat Western medicine concepts or diagnosis. And so for your initial session, we ask you all kinds of questions, some that pertain to your chief issue, and some that may seem like it has absolutely nothing to do with anything. We take all of those symptoms and we categorize them into what's called patterns, and then we treat you based off of your Chinese medicine pattern. That means that each individual has a unique presentation, and as such, we treat you based off of your unique situation and your unique presentation. We also view the body as a whole. So frequently, you might be coming in for one presentation or one issue, but you might see maybe changes with your digestive system change, even though we're treating you for pain. One size does not fit all. There are many different types of styles of acupuncture. Just like within Western medicine, we each have our specialties and we each have different tools within our toolbox. And so some individuals may respond very, very well to something like traditional Chinese medicine, but maybe don't respond to Japanese acupuncture. So each practitioner really has their own tools within their toolbox. Some work with different styles as well. For example, I work with and study not only traditional Chinese acupuncture, but the balancing method. By utilizing things within the balancing method, I'm able to, and let's see if we can, by utilizing a style like balancing method, I'm able to have an effect on, say, the neck by needling the wrist over here or over here, depending upon what's going on. Styles like the balancing method take into account what is the sick meridian. So if the sick meridian is on the back, I will choose a different meridian and different points to help balance that. A lot of times we find that people respond to this style of needling while they're on the table, which gives us an idea of how we want to proceed forward. And sometimes people don't respond to the balancing method, but they respond really well to local needling. And in that situation, that's what we do. But there are other styles like Japanese acupuncture, five-phase or five-element acupuncture, master tongue style. Balancing method is actually based off of master tongue style. There's also motor points. So motor points are really, really beneficial for musculoskeletal disorders. However, for people that are more deficient, they tend to not respond well to motor point style of needling because it is a little bit more of an aggressive style. So each one has its inherent benefits. And as a practitioner, sometimes it's important to recognize where does that patient fall, how do they respond to things, and recognize that there might be a style that might be better for them than the one that they're currently utilizing. Historically, acupuncture has always had this very esoteric feel about it. It was considered to be very woo-woo for many, many years. Now there's studies that are coming out and showing what acupuncture actually does. So we know that it stimulates nerves, connective tissue, blood circulation. It helps to decrease cortisol, which is your stress hormone. We also know that it helps to release melatonin and promotes relaxation and elevates that positive mood response. It also stimulates endorphins, which are the body's natural painkillers. We invite you to join us on Instagram, LinkedIn, and Facebook. We do post different articles as well as research and information throughout the week. Thank you so much for joining us. Bye-bye.